I am super excited to have Anna Gassman-Pines with us. Anna is a professor of public policy at the Sanford School at Duke, and happens to have been doing a really important and exciting study before COVID hit on low-wage workers. And then COVID hit and she was in the field and had an opportunity to learn a lot about what's been happening in the last year. So I could not be more thrilled to have her with us. She's one of our IRP family, but also to hear what she's been up to in the last year. So without further ado, and with great gratitude, I will hand it over to Anna. We're excited to hear all that you're going to tell us. Thanks, Anna.
Thank you so much, Catherine. And thanks to all of you for being here. I met with the graduate students earlier and I said to them, it's become kind of trite to say in these times, I wish we were together in person, but I really do wish we were together in person because I am a native of Madison, Wisconsin. I love Madison, and I'm always looking forward to a visit to my hometown. So I look forward to getting a chance to come back to IRP when we can all do so safely and in person. So it is my pleasure to get a chance to talk to you today about ongoing work I've been doing with my colleagues, Elizabeth Ananat and John Fitzhenley, on the effects of the COVID pandemic on the economic and psychological well-being of hourly service workers and their families. So to motivate this talk, despite vaccine progress, many dimensions of the COVID crisis are continuing to dramatically alter daily life in the United States. And the policy response to supporting families has been inconsistent over the last year. So a better understanding of what vulnerable families are experiencing, we hope can improve the response going forward. The extraordinary events and policies implemented of this time are likely to be highly generative for future research on children and families for years to come. And what we hope is that our work can contribute to a first draft understanding of this period to build on as more data become available over time. So in this project, we document the daily experiences of a representative sample of service workers with young children at the beginning of the pandemic, including high levels of job and income loss, caregiving burden, and material hardship, and relatedly, alarming levels of psychological distress. We provide snapshots of the mixed success of policy supports that have been implemented in response to the pandemic, such as pandemic unemployment compensation, in reaching families, which is suggestive of shortcomings in our systems for targeted aid. And we provide some early estimates of the causal effects of school and care disruptions this fall during the first half of the school year on family well-being, where we're finding that disruptions to family school and care arrangements are quite common, occurring on about a quarter of all days throughout the fall semester. And with family fixed effects, we show that disruptions on a given day cause rises in psychological distress for both children and parents. But before we get to that, let's back up to the very beginning, because actually this story starts in August of 2014, when the New York Times published this article called Working Anything But 9 to 5. I would highly recommend that you take a look at it. It follows the story of this young woman pictured here, Jeanette Navarro, and her young son, Gavin. And Jeanette was working at a Starbucks at the time that this story was written. And what this story did was to document how unstable and unpredictable Jeanette's work schedule was. Sometimes she would be working, it would be slow, and her manager would say, we're just sending you home. The shift is ending, 2 hours early. Sometimes she'd be on call and she wouldn't know what her hours were going to be until the night before. This caused a tremendous amount of strain for her as she tried to navigate managing care arrangements for her son, and also prevented her from successfully taking the community college classes in which she was enrolled. And so this story really caught our eye as policy researchers and scholars of child development. It also caught the eye of many policymakers. And so in response both to this story in the New York Times, as well as to a tremendous amount of organizing on the part of labor organizers around the country. Several things happened. First of all, Starbucks, where Jeanette worked, announced that they were banning on-call scheduling practices after that New York Times article ran. The New York Attorney General sent letters to several major retailers, kind of calling them out for these unpredictable scheduling practices and telling them that if they didn't stop doing this, he was going to sue them in New York State. And several localities and one state passed laws regulating the work schedules of service workers in different sectors. One of those cities was the city of Philadelphia, which passed a law in December of 2018 that was to be implemented on January 1st of 2020. And so as we began thinking about both the lives of these families and the policy response, we launched an early pilot study in the city of Emeryville, which was one of the localities that passed a schedule new schedule regulation around unpredictable work schedules. Where we developed a venue time sampling design to get a 1 in 6 representative sample of an unrostered population, that is hourly service workers in retail and food service who had a young child between the ages of 2 and 7. In this pilot study in Emeryville, we recruited 96 workers with custody of a child aged 2 to 7 and asked them to answer 30 days worth of daily surveys before the law took effect, during another 30 days during what Emeryville called the soft rollout of that law, and then another 30 days during the full enforcement, where Emeryville said, okay, at this point, we are going to actually fine employers if we learn that they are not compliant with these new regulations. And what we found in that work is that in the pre-period, compared to the same family on days when work went as expected, on days with work disruptions, where something about that parent's schedule was changed unexpectedly, workers had worse mood and reported worse sleep quality. So these unpredictable work schedules really are very harmful to working parents. When we compare pre and post, what we found is that compared to workers in control firms, workers in treated firms had fewer work disruptions in the post period and better mood and sleep, but also lower total work hours. So there's some preliminary evidence on a small scale that regulating the schedules of hourly service workers can reduce work disruptions and possibly improve worker well-being, even if it means that workers work fewer shifts. We were then able to use that pilot study and were poised to conduct a much larger scale study looking at the same set of issues in the city of Philadelphia. So over the fall of 2019, we recruited about 1,100 participants who had all completed 30 days of daily surveys before Black Friday. And the reason for that is that schedules get particularly unpredictable and unstable during the holiday season. So we really wanted to make sure in Philadelphia that we had all of that data collected before the busy holiday shopping season. We again used a modified venue time sampling approach, and I'm happy to answer any questions about the methodological details that people are wondering about, but the short version is that what this means is that individuals were recruited at their place of employment. So we had 22 amazing on-the-ground staff in Philadelphia who were assigned to walk around different parts of the city on different days at different times of day, and to go into businesses that were either retail, food service, or hotels, and talk to workers, talk to folks to see whether they were parents of young children, whether they knew of other people working at that time, at that business at that time who were parents of young children, and to do the initial recruitment of the survey in those venues, that is in those businesses themselves. This is a sampling approach that was really pioneered coming out of public health, but is commonly used in public health for generating representative samples when there's no existing roster or list of the universe of potential participants. In December of 2019, the city announced that, yes.
Anna, I'm going to interject. Could you talk a little bit about the challenges that you faced doing that, either in terms of employers not wanting workers to talk or workers feeling like I love this approach. And so those of us that are not public health and haven't done it, I would just love to hear more about some of the challenges and how you got around them. And it's just so cool.
Yeah, so it is challenging. And sometimes workers' first impulse would be, oh, let me bring you over to my manager. And usually when that happened, the manager would say, please leave. And so sometimes we weren't able to recruit in a particular business at a particular time. But our staff really worked hard to just build rapport quickly and when they could. So we're, had different ways of kind of engaging workers, figuring out that, like the folks working the cash register are usually really busy. And so they're not good places to start because they're often not able to talk while they're kind of working the cash register. But folks who are stocking shelves or who are, like folding clothes, for example, often are able to briefly chat and are people in our society where, folks are not usually coming to them and saying, I want to learn about your daily life. I really want to hear from you about what your experience is working and raising kids. And I hope that you'll be willing to do this. And so the other thing is that in that initial recruitment, of course, we needed to explain what was going to be asked of people. That's an ethical obligation we have to our participants, but we didn't ask them to do anything in that moment besides once they had heard what the study was about and agreed to simply give us their contact information. And what we were able to do right then is right away, just as soon as they agreed and gave us their contact information, to hand them an initial gift card that they were given right away. And so that was also a way of kind of building trust in the moment to say, this isn't a scam, this is legitimate. We really want you to know that when we say we are going to compensate you, we will do so. And so we really worked hard on kind of building rapport and building trust, right away in the moment. And we were able, with a highly diverse set. That was the other thing, a highly diverse set of research assistants from a range of backgrounds, some speaking English and Spanish. So we're able to talk to folks in Spanish if Spanish was their native language. And we're all also members of that community. So we didn't bring in staff from North Carolina to go to Philadelphia. We hired folks who were local, and I think that made a difference as well. So in December of 2019, the city announced that they were going to delay enactment of that law. And they were the new date for the beginning of enforcement of the schedule stability law in Philadelphia was going to be April 1st of 2020. And I think you can imagine where the story is going. What we did in response to that is to launch another wave of pre-implementation data. We really wanted to make sure we kept our participants engaged, that we kept in touch with them, that they were used to participating in this study ongoing. And so in mid-February, on February 20th, we launched Wave 2, where we were asking folks to do a shorter set of days, 14 days of surveys, to really make sure that we had valid pre-data when the law was supposed to be enacted on April 1st. But of course, as we all know, because we've just lived through this, in mid-March, everything changed. And we quickly pivoted to collecting data on families' experiences during the pandemic. Fairly quickly after restrictions were put into place, the city announced a further indefinite delay of the implementation of that law. So the original goal of the study of following these families before and after implementation was indefinitely on hold. Meanwhile, we realized that we had an opportunity to really learn in real time how this sample of hourly service workers with young children was faring during the pandemic. This is a group that was became highly visible in the sense that many of them were essential workers, what we've been referring to as essential workers throughout this pandemic. So a highly policy relevant group. And we spent the better part of 2020 following up with them, fielding surveys to learn about their experiences with work, income, well-being, and accessing social services. And we're currently in the field now with another round of data collection about experiences during the pandemic. Additionally, and I'm excited to talk about these brand new results today, in the fall, we collected an additional 30 days of daily surveys to which we added COVID's related questions. So what does this sample look like? Who are we talking about? Not surprisingly, given that these are folks who are working in the service sector and are hourly workers, the vast majority of the sample are people of color. So just about half the sample identifies as African American. And then just over 22% of the sample identifies as Hispanic. Only 18% of the sample identifies as white, non-Hispanic. Also being consistent with being caretakers of young children, the sample is majority women, so 83% identify as female. Without a lot of access to formal higher education. So 26% of our sample has less than a high school education, and another 44 has completed high school but not had any additional formal education. And this is a group of families, unsurprisingly, who had low income before the pandemic started. So this is from the information we collected in 2019. On average, the parents are reporting that they had about $2,200 a month in household income. And the focal children in this study were just about 5 years old in the fall of 2019. So they were on average 6 years old in fall of 2020. All of our data collection used text messages, and I'm happy to talk your ear off about what it means to collect data from families using text messages.
Anna, I would actually like you to talk maybe half my ear off, because again, I think it's super interesting and not a conventional way that people think about data collection, but yet incredibly valuable. And we're, all learning about how to be more like you. So, so more, please, more rather than less on this. I think would
wonderful. Okay, so I think text messages are an incredibly powerful tool for gathering social science data in this current moment. And I mean that actually more broadly beyond the pandemic. And there are a few reasons for that. The first is that nearly everyone in the United States across income level has a mobile phone at this point. Not necessarily a smartphone, not necessarily a regular, unlimited data plan like you or I might have, but a mobile phone with basic capability to send and receive text messages. So you can reach a wide range of people. The other really nice thing about using text messages is that people can answer your surveys at a time that works best for them. So it actually facilitates kind of work-family balance for the participants themselves. And so the way that it works is these surveys are programmed and it's all automated. So I'm not sitting there texting 1,100 people each night. It is automated. The first question of the survey is sent out at 7 p.m. each night. And as soon as that participant sends back the answer, the second question is automatically texted to their phone. And that cycle repeats until they've gotten to the end of the survey. If they don't answer that the first question until 3 hours later, that's totally fine. It will automate just as soon as they do. If they get through half the questions and then they need to put their kids to bed, they can do that and come back and pick it back up and answer the rest of the questions at a later time. And so, for example, in contrast to a phone survey where you have to coordinate the interviewer and the participant to get on the phone at the same time. The participant has to have a block of time available for answering all the questions in one sitting. By using text messages, people can do it at a time that works for them. We have folks who are at work at 7 p.m. when that first question goes out, and they don't answer it until maybe 11:30 or midnight, and that's totally fine. And so it's it's actually quite a powerful tool. And because we had been planning this all along, our participants were used to it. This did not reflect a change from, for example, a study that had people doing in-person surveys or home visits and then switching them to text. We had been planning for this mode of data collection from the very beginning. In our particular, the daily surveys gather detailed information each day about whether that parent was at work, what that parent's work schedule was, whether that the work schedule was disrupted in some way, whether it was canceled or cut short or lengthened. And then each day we ask questions that get at parent mood, parenting behavior, and child behavior. And if you have a smartphone, this is what it looks like, for example, on my phone.
Two questions, one of which is mine and one of which is from the audience. So
yeah.
Do you have a resource for creating a text survey? So if someone wants to propose it to their own agency. So like what company or how did you set this up? My other question is, could you talk about the trade-offs between this approach, and I'm asking this question for Maggie Kerr, who's over listening, compared to like sending out a link to a Qualtrics survey that is similar in that you can do it in your own time, but isn't actually like literally via text, which is what I see that you all did.
That's right. So to the first question first, there are a whole bunch of companies nowadays that do it. The one that we use is called Mosio, M-O-S-I-O. They're based in San Francisco. And this is their entire business, is text message surveys. This is what they do. And we like them in particular because this is what they do. Their interface works with all different kinds of phones and more importantly, all different kinds of mobile providers, mobile services providers. So for example, Qualtrics, which a lot of us are familiar with, also has text message survey programming capability. At Duke, we have to pay for it. It's not part of our standard business agreement between Duke and Qualtrics. But it is kind of within the standard Qualtrics interface. The thing is that it doesn't, Qualtrics text messages don't interface seamlessly with as wide an array of mobile service providers as Mosio does, which when you're reaching low-income families makes a huge difference in terms of participation, because folks use all kinds of low-cost mobile services providers, not just the ones that you or I might be able to think of like Verizon or AT&T, but a whole bunch of others that are more geared towards folks who might pay monthly or might be buying minutes or data kind of as they go. And Mosio allows for the same kind of functionality, but allows that to reach folks kind of no matter what provider they use. And the benefit to using text messages over a Qualtrics link is that, so for example, for a lot of our families, the text messages are paid for separate from data. Once you click that link and it goes to a web page, now you're using a different data plan, and a lot of folks in our sample don't have much data, if any at all, but they still have text message functionality and capability. And so again, it allows us to reach more people and have more regular ongoing data collection without them needing to use data to pull up a Qualtrics and answer the questions on a website. To be clear and to be fair, the downside is you have to be a little bit more limited in the number of questions you can ask via text. It's just it takes a little bit longer, the back and forth waiting for the messages to send. And so I do think you have to be a little bit more circumscribed with the length of the survey instrument itself. All right, I'm going to go quickly through this. If you see something where you want much more detail about the measures, please put that question in the Q&A, and I will have Catherine interrupt me, and I will talk more about it. But in the interest of time, I will go quickly. We ask a whole bunch of questions about work, in particular, whether people are still working or whether they've had to reduce their hours because of care or school closures. We ask a lot of different questions about income and material hardship, including income changes since before the pandemic, and questions about challenges with food insecurity and housing. We ask about other stressors and supports. A lot of questions about different policy supports, both kind of your traditional social safety net policies and supports that were provided uniquely during the pandemic. We ask about safety at work and while commuting, food insecurity, mental health, both parents' own and the reports about their children. Income, we separated into two questions, really trying to get people to think about income from work, that is, what are they earning, and then additional sources of income, for example, from UI or stimulus payments that they might have received.
Anna, did you, and just interrupt, it's me again, so sorry.
Yeah,
but
no worries.
You can tell I'm totally engaged. What time period were you having people answer about? Like when you say, has your income fallen by half? Did you just ask that, or did you say in the last month, in the last week?
We were just asking kind of a general, their subjective sense of how their income differed from before the pandemic, but we did not put a specific time window on it. And you'll see it actually turns out to be pretty responsive to people's circumstances, those questions.
Okay. And then how long did it typically take for participants to fill out the survey is one question from the audience. And two, how you measured work schedule unpredictability and volatility. So Anna, one of our great social work graduate students, is trying to figure this out in her own research right now.
Oh, great. Yes. So the daily survey typically takes about 10 minutes a day. It can take less than that if things went very smoothly, and it can take a little bit more if it was a particularly chaotic day with a lot of work schedule changes. The way we gather information about that unpredictability is for up to 3 jobs. We ask the parents, did you work at, say that person works at Home Depot. Did you work at Home Depot today? If they say yes, then we ask, when did you start? When did you stop? Is that when you were originally scheduled to work? And if they say no, then we say, when were you originally scheduled to start and stop? And we have instructions about what to text back if that shift was originally on the schedule at all. And then for people who say, no, I didn't work at Home Depot, we say, were you originally scheduled to work at Home Depot? Because of course a shift could get canceled. So if you didn't work today, you might have had a shift on the calendar that got canceled. And if they say, yes, I was supposed to work, we say, when were you originally supposed to start and stop? So we know how many hours were lost when that shift was canceled. And so that will loop through for up to 3 jobs. The majority of our participants only have one, but a non-trivial minority, I think between 15 and 20% have more than one job. And so then it'll, once they answer that set of questions about Home Depot, then it will loop back and say, okay, so then text, did you work at Burger King today? And work them through the same questions. So that's how we measure unpredictability at the daily level. And so again, you can see if you work multiple jobs and you had many things change about your schedule, it could be a little bit longer. If you work only one job, you didn't work, you were never scheduled to work, it can be a little bit shorter. In the ongoing surveys, we added questions about school arrangements, where children were learning or being cared for. And in particular, this fall, we added questions to the daily surveys, including, did your children's childcare or school go smoothly today? That has happened on schedule, internet worked if needed, etc. And then parents could say yes, mostly, somewhat, or not at all. Okay, so what I'm going to do now is just talk through a set of lessons that we've learned using these data to illuminate the experiences of these families during the pandemic. The first lesson is that the initial very acute phase of the COVID-19 crisis was a very hard time for families. So what you can see here in this figure, this is time moving across the x-axis in days, and the orange line is the percent of folks in the sample who worked that day. So it was going along. It is going up and down like this because even though a lot of people work on weekends, fewer people work on weekends than on weekdays, but looked fairly stable right up until the moment when schools were closed and non-essential businesses were closed. And right away, you can see how being at work dropped dramatically. The blue line is a composite of family mental health, and similarly was fairly stable in the weeks leading up to those restrictions putting in place and dropped quite quickly after those initial restrictions were put into place. Additionally, the more hardships families were experiencing during that early phase, the worse everyone's mental health, both parents and those focal children. There's a lot of numbers on this table, but the key takeaways here are that these stressors that occurred during this early phase, like an adult in the household being laid off, that family experiencing income loss, increased caregiving burden, or family illness, was generally related to both parent and child well-being, but in particular, when those hardships accumulated, that was particularly detrimental for family well-being. So when families were experiencing 3 or 4 of those hardships, we see very strong relations with both parents' mental health and parents' reports about children's mental health. The second lesson is that families are continuing to face ongoing difficulties and really continued to face ongoing difficulties throughout 2020. So here, and in particular, continued difficulties with working. So the blue line here is the percent of our sample that was employed at these 4 different time points. The orange line is the percent who are unemployed, and the gray line is the percent who are out of the labor force. So although employment has rebounded somewhat for these parents and unemployment has dropped, there has been a concomitant increase in being out of the labor force, and that primarily seems to be driven by the need to oversee remote schooling and care for the children.
Anna, can I just ask, so you're starting in March and April, were they all at like 100% in, right? Okay.
Yes,
so,
that's really important to point out. Yeah, so everyone was working at the beginning.
Right, but
right.
you had sampled them in November as working, so I imagine it probably wasn't 100. Like, I'm just trying to wrap my head around what percent were probably working in, say, January or February.
That's a really good point. And I will look back and see, but in February when we were recruiting them into that next wave, the vast majority of them were still employed. So yeah, so 100% were employed when we recruited them because that's how they got into the study. The vast majority were still employed in February before
I'm not one to typically give feedback on graphs, but I think that's really important because otherwise it's like, oh, look, everyone's working more, right? Like if we're not listening carefully to you.
Right. Because it's actually like a huge drop from.
Right. I think that's important.
From where they started in February. That's a really good point. And I can definitely add that in to a future iteration of this figure. Yeah, absolutely. Families in our sample have faced substantial increases in food insecurity. So here I do show February, pre-pandemic. And this is a group of families who had many challenges even before the pandemic. So even before the pandemic, almost a quarter of folks were saying they were worried about running out of food, or that food had actually ran out because they didn't have enough money for food. So those leftmost set of bars are what these families were experiencing even before the pandemic. So a lot of challenges to begin with. But then, as you can see, throughout 2020, those aspects of food insecurity have increased substantially. Both worry about running out of food, which is quite elevated, as well as actually running out of food, which has been elevated and remained elevated throughout 2020. And this is consistent with data from the household pulse survey from the census that showed really substantial increases in food insecurity, and especially among households with children generally during the pandemic. And we see that echoed here in our own sample as well.
And you're talking about things that I'm thinking about all the time now. So I wanted to ask you quickly, what was the average income sort of before, and do you have a sense? I'm trying to figure out something about my own study sample, but were these what was the average earnings? I'd say pre-COVID, because who knows post-COVID, right?
So our average income, monthly income, with all the measurement error that goes along with that, was about $2,200 a month.
Okay.
So
doesn't that look like low food insecurity to you? High food security pre-pandemic for that level of income?
For that level of income, good point. It might be right now. I don't want to get it backwards. We might have expected it to be higher, given that these are quite low income folks. Now, of course, so much about the context changed, and in particular, the schools being closed and the schools being such an important source of meals for a lot of children, that some of this might in the post period might be really reflecting both actual economic need, but also just a wildly different context, right?
Right.
So here is where I'm showing you this question about people's kind of subjective reports about how their income has changed since before the pandemic. So among those who are employed, many of them have still report that they have lost income from earnings, that is income from work, relative to where they were before the pandemic. So the red parts of the bars here are the share of folks who said they lost more than half their income. The light red or pink is folks who said they lost less than half their income. The light green is folks who said my income's the same as it was before. And the dark green is people who said they're actually earning more. So they have higher income from work now. And people who have continued to work could have less income from that work, either because they're working fewer hours, or if they're working in tipped jobs, which a lot of these folks are, they could have also lost income from tips. So even if they're working the same number of hours, they might be getting less in tips on any given shift. So their income, at least the subjective report about their income when they think and compare now at these moments in time to before the pandemic, looks relatively stable since June. For the unemployed folks, now the main thing to notice here is how much taller the red and pink is for these unemployed folks. Of course, many of whom have not been able to re-engage with work, and so have experienced substantial income losses that, if anything, their reports about how large they are have grown over time.
And Anna, this is income from work or total?
This is income from work, and I'm going to show you next when we ask them to think about income from work plus income from other sources like UI and stimulus. So we'll get to that in just a second. Because it relates to lesson 3, which is that families' difficulties have been unevenly addressed by policy remedies. The setup here is the same in the sense that the meaning of the bars is the same. On the left are the people who were employed in April. Those 2 bars are the folks who were employed in April. The 2 bars on the right are the folks who were unemployed. And so I'm repeating bars. When we just look at income from work, the left set, and then when we ask them to add in work, income from work plus government supports, where we say, any money you might have gotten from the government, like money from unemployment or a stimulus payment, or other money from the government. And so this is some evidence that the stimulus that was passed in the spring in response to the pandemic did help buffer families from large income losses. And the way to see that is to just, for both sets, to compare the height of that red and pink from the left to the right. And it goes down in both cases. I think you can see my mouse. So for the unemployed folks, right, they're up here where over 70% of them say income from work was a loss. But when we ask them, okay, so now think about income from work plus from supports from the government, the share of them saying that they have experienced an income loss is much lower.
And do you think it would have, I know there was like slow rollout of supports and backlogs of UI. Did it look very different if you looked at May or June?
That's a good question. And I could definitely look at that. So this is lumping together May and June, whenever folks answered, but we did, starting in the May wave and for every subsequent wave, we actually have randomized within the sample when people get the survey to be able to tease apart a little bit more about the timing. So I don't have it here, but I could definitely look and see, did it look different in June compared to May? What I can say is that the effects of these supports had largely faded by September when a lot of these benefits had expired. And so the same set of figures, when we look at what's going on in September, now those red bars look much closer to each other than they did in the June wave. And benefits that people are presumably eligible for don't always reach everyone. And so this is an illustrative example that's highlighting the experience of trying to get unemployment insurance for those in our sample who were laid off. So nearly everyone tried to apply for UI, although some folks said they thought they weren't eligible or that it seemed too difficult. Of those who tried to apply, 95% got through the process. Of those who successfully applied, only 62% received UI. We know that there were backlogs, difficulties with getting benefits during this time. And then of those who received UI, only 84% had pandemic unemployment compensation, that additional benefit that was added in spring included in their check. And really importantly, this varies for different groups. So Hispanic respondents are more likely to perceive they're ineligible for UI and don't try to apply. And additionally, Black respondents are less likely to actually successfully receive UI, conditional on getting through the application. So another way of visualizing this that I'm really excited about and super grateful to the folks in the Duke University Library's Data and Visualization Services for helping put this together. This shows kind of the flow through the UI application process, and the key thing to take for the Black parents, the Hispanic parents, and then at the top, this dark orange are the white parents. And the key things to take away here is this big branch down for those Black families who get through the application process, but for whatever reason, by the time we surveyed them, had not gotten their benefits yet. And similarly down here, a much fatter branch of folks, among the Hispanics not getting through the application. So real differences by racial and ethnic group in terms of being able to access one of the key programs that was passed in response to the pandemic, at least in that spring, summer part of the 2020. Why didn't benefits reach everyone? These applications were designed to create hurdles. They were not designed to be smooth sailing during pandemic times. For many states, the systems are antiquated and often can't be updated to eliminate hurdles in a moment of crisis or to otherwise enact more reasonable new policies. And a lot of unemployment offices are understaffed. We've had a tremendous problem with understaffing, for example, here in North Carolina. But it's certainly the case that more research is needed to understand where these disconnects occur and how to address them. And then the fourth lesson is that the pandemic is continuing to take a toll on mental health. We see chronic mental health struggles in our sample. In fall of 2020, nearly half of the parents in our sample screened positive for major depression, generalized anxiety, or both depression and anxiety. 17% of parents report that their children are sad or worried the majority of the time. And we have some very preliminary evidence that the chaotic schooling and care situations in the first half of the school year, probably coupled with the sunsetting of those pandemic policies, may be a significant driver of mental health challenges for families. So this is some really hot off the presses data that I want to show you, where we took that daily question about, did everything go smoothly? And this is the share of families throughout the fall who said, no, it did not go smoothly at all. And it seems to be, trending down somewhat as things presumably, everyone kind of got into more of a routine by the end of, kind of by the middle of November. But nevertheless, throughout that period, throughout the fall semester, disruptions to school and care were very common. So overall, on nearly a quarter of the days, parents are saying, no, things did not go at all how they were supposed to go. And this is true both for folks who are using in-person care arrangements for their young children, as well as those whose children were in remote school. And in fact, disruptions to schooling were more common among families whose kids were learning remotely, presumably because of challenges with internet, with technology, and all that needs to kind of be in place in order to have a successful remote learning day. And then parents who have some kids in remote and some kids in person have actually the highest amount of disruptions on any given day because, of course, their care in school can be disrupted from multiple sources. And it's not just the case that certain parents have very chaotic situations. It is actually the case that almost everyone in our sample, nearly 80% of the sample, had at least one disruption to their school and care arrangement during the month when they were answering those surveys. So this is happening to almost everyone at least one time. When these disruptions happen and things don't go as planned, it is strongly related to both parent and child well-being. So this figure shows you 4 different outcomes. Parents report that the focal child was uncooperative that day, that the focal child seemed sad or worried, that the parent lost their temper with the child, and the parent's own report about their depressed or anxious mood. And so the blue bars are kind of how everyone's doing on a typical day. And the orange is the increase over and above that on days when school or care is disrupted and does not go smoothly. These are all statistically significant in family fixed effects models. So in other words, for any given family, compared to a day when everything goes smoothly and as planned, on a day with a disruption to care or schooling, parents are reporting much worse mood themselves, but also that their children are behaving worse and seem to be more sad or worried.
Anna,
So, yeah, Catherine.
This is so exciting for me. So talk to me about how important you think the disruptions to school or care are relative to like life in the pandemic. Right, like, because you're making a point about how disruption, like bad days of disrupted work or disrupted scheduling, like make things worse. But
yep.
You could imagine a version of this where, and you won't, right, like granted, you had this study going and then the COVID happened. And so there you go, right? Like you could imagine that maybe 12% isn't that much worse from like a bad day for someone feeling anxious, depressed, because in normal times, only 20% of moms would have felt depressed, but then it would have jumped much more. But because we're already, I'm including me in this, because we're already so depressed or anxious with our kids home and all this other stuff, that it's not incrementally, it's less than it would be otherwise. So I know you can't wave your wand and know what would have happened had COVID not happened, but your thoughts on the magnitude of these sizes.
Yeah, so I mean, what I can tell you is that we've looked at, with the pre-pandemic data, we've looked at the effects of disruptions to parents' work schedules on this same exact set of outcomes.
Yeah. And
what we see there is very consistent with what I presented at the beginning of the talk, which is that on days when work is disrupted, parents also feel much worse. The effect size is not this large, though. It is statistically significant, but it is not. I don't think it's quite this large. But parents tend to or appear to buffer their children from those effects of parents' own work schedule disruptions. So we actually don't see the same kind of spillover to either to parents losing their temper, so to their behavior, how they're interacting with the child, or to their reports about child behavior. And we were, I think, somewhat surprised. We thought we would see more family spillover and see more effects of parents' work schedules on kids' own well-being, which we don't see in the pre-pandemic data. And so I think, here, when children's own kind of setting is disrupted, their own schooling situation, their own care situation, there may be some spillover from that stressing out parents, but there also may be, direct effects on the children themselves from having, their own setting in which they're participating directly interrupted unexpectedly.
Thanks.
All right, so in terms of implications, we think taken together, this shows that continued supports for working families are needed. I think the good news is that some of this has happened. So the December extension of expanded pandemic unemployment compensation was one first step. And of course, the additional stimulus that's rolling out now should help even more. But I also think more attention needs to be paid to ensuring that all families, and especially families of color, are receiving benefits to which they are entitled. And that we really need to continue to think about family mental health and family well-being, to think about strengthening systems, addressing family mental health, and investing in additional family supports. So just in conclusion, before we have a broader Q&A, the effects of the COVID crisis on hourly service workers with young children on work, income, and well-being were immediate and striking. And effects on families have persisted as the pandemic has persisted. Policies aimed at providing income to families during the crisis have helped, but their reach has not been universal, and little attention has been paid to family mental health needs. So additional public supports will help families in need. And I want to thank you all so much for being here today, and to support the generous funders of this work.
I am unmuting. Awesome. So folks, if you can go ahead and put questions in the chat, and I would usually start off with a softball one, just to give people time to type. But Anna, so again, totally selfishly, I want to hear more about sorry, I want to hear more about response rates for the texting. Like, how many people did you lose? How many days out of 30 did they respond?
Yeah,
all that.
Yep. So there's actually a couple different issues about response rates, right? One is when we do these daily surveys, kind of within WAVE, how much do people who have chosen to participate in the WAVE actually end up doing? And then there's the question about how many people choose to participate in any given WAVE. So our participation in the daily surveys is quite high. And what ends up happening is actually over the waves, it improves because the people who are the least connected to the study don't continue to participate. So for example, in wave 1 at the beginning, I think about just under half the sample did all 30 days. And then the vast majority of people provided like at least 2 weeks worth of data. So we're getting, quite a lot of within family variability. There's a small set, I think it's, hovers around 10% of folks who enroll and do, 0 or 1 of those daily surveys. So the within WAVE daily response rate actually improves because, again, the folks who are least connected to the study don't enroll in subsequent waves. But in terms of the overall enrollment, it has been around, it has ranged from between 65 to 80% of the sample retained throughout the pandemic.
What kind of incentives do you provide?
So it depends on what we're asking them to do. For the one-time COVID surveys, we try to make it more generous as time goes on because we know that we're going back to these folks and want to keep them engaged. But it's around $25 for the one-time COVID surveys. For the daily surveys, we actually have a somewhat complicated incentive situation because we are trying to incentivize folks to do as many days as possible. So we do $1 a day, but for each full week that you do, you can double it to $2 a day, and then also get bonus money like at the end of the week or at the end of the 30 days. If you've done everything, there's additional bonus on top of that. So when you piece it all together for a month, it can total up to $100, depending on how many surveys you do.
Awesome. So I'm going to ask a question from Steve Cook and then Anna Walther. Then I'm going to promote you to speak, Anna, because rather than for me to read your comment, you can. So Steve asks, I know you said you're in the field now. Do you have plans to do another round, especially in July or later when families will start receiving child tax credits? And in current or future rounds, will you be asking about UI benefit receipt again to see if the non-receipt was due to delays or denials? And I'll add to that. Do you know anything? Because they were all in what city? Were they all in one city?
They're all in Philadelphia. Yep. So all in state of Pennsylvania.
Yeah. So wondering what you know about what happened in Pennsylvania related to UI too. So we'll start there and then.
Yep. Yes. So we have been very fortunate. We've just received additional grant funding from the WT Grant Foundation to continue this work. We really wanted to try to continue to survey folks until we got to something looking like recovery and are continuing to do additional grant writing. So we will continue to be gathering information. We're at every wave, we've continued to gather information about UI, and we've, in the one that's in the field right now, designed some questions to try to go back and just retrospectively, which is not perfect, but at least try to fill in the gaps about some of those folks who had applied but not gotten it, to try to see whether they ever did end up getting their benefits. So we will have additional information about UI throughout the study as long as it continues. And we'll also design questions about the child tax credit that we can field over the summer as well.
Awesome.
And I value your input about how to do that. One thing I've learned, for example, is that asking folks about the receipt of PEBT, the pandemic EBT, which was money to replace missed school meals, is quite difficult. And I don't think we've gotten that right yet. So but would want to make sure we avoid any kind of mistakes around asking about the child tax credit, because that's super important to learn about.
Anna, I have promoted you to speaking, so you can unmute and provide your comment.
Yeah, thanks so much for your presentation. It was really interesting and insightful, just because I'm working on like a similar project where we're looking among child care subsidy recipients and looking at relationships between child behavior and different items of unpredictable work schedules. And I just think it's helpful to see that you're sort of we're seeing something really similar, where the unpredictable schedules are associated with higher levels of work-family conflict and parenting stress, but then that isn't spilling over into child behavior outcomes. And I can't speak to it too much, it's super preliminary and we're still trying to parse everything out, but that is really helpful to know that there is sort of a strengths or some sort of buffer effect going on that we'll have to keep investigating.
Thanks. I'm excited to learn more about your work.
Thanks, Anna. Hillary also has a question. You can tell we're all methods nerds here. So related to response rates, yes. We have had problems with mobile phone numbers going bad over time. So participants might have still had a phone, but a new number, can't afford a new phone for a while. Maybe this is less of a problem since you're in touch. You're so in touch with them. And Hillary's project has a longer lag time between surveys. But did you have any problems with this? And if so, how did you work to mitigate it?
Great question. It's always a challenge, absolutely. We do a few things to try to mitigate it. One is we offer a $10 incentive that we will pay anytime someone updates their phone number with us. And as often as that happens, we will pay that compensation. We also asked folks to provide us with the names of additional, this is pretty standard, the names of additional people who might know how to reach them, the names and contact information of additional people who might know how to reach them. And some people gave us that information, but we did not make it mandatory. And so we then have also been incentivizing sharing that with us. So if you share the names and contact information of 2 people who will know how to get in touch with you, we will also pay you $10 for that. And then, so those have been our 2 most successful strategies. I mean, the other thing we do is we do ask permission in our consent to reach out to people on social media. So so for those who consent, we can try to find folks and contact them on Facebook or Instagram. That's kind of a last ditch effort that has not been as successful as the other two things I mentioned.
Another question for me. Did you consider getting administrative records or trying to do so now? Because that might help with the UI, EBT.
So I've just been thinking about that. And thinking that in the next wave, we really should consent people to get their records. I don't really know. I know a lot about how to do that within the state of North Carolina. So I will need to learn more about Pennsylvania, but yeah, I'd actually recently been thinking that would be a really important addition to the study.
Yeah.
And answering that makes me realize I didn't answer the question about UI in Pennsylvania. So actually, Pennsylvania is actually known as a state that does a really good job with UI, just to put this in some context. So yeah, Pennsylvania is known to be pretty strong on UI, on support for applications, on having like community navigators and folks who help people apply for UI. That's in, obviously in normal pre-pandemic times. So I would almost think of this as like kind of the best case scenario. We're in a state where they in general try to do a good job, and still there are a lot of gaps and challenges.
Yeah. And I'll ask one final question, which is my own again. I'll put on my social work hat and say, okay, mental health, what can we do in the pandemic? Like, what would that look like? What would that have been that would have been useful to parents?
Yeah, I've been thinking a lot about that too, because of course, our whole healthcare system and our mental health provision has also been disrupted.
Right.
So, I think there has been some, this is not my area of expertise, but as I understand, there has been some kind of creative work around telehealth and really trying to use technology and I think some work with health insurance providers to cover those kinds of visits, and especially to cover them at the same kind of rate that you would cover an in-person visit. And so it seems like, at the same time that technology has been a real challenge, I think, for families, especially around schooling, it is, I think perhaps there could have been more of a window towards using that, not just for teaching kids, but also to be checking in with children and parents around emotional well-being in general. Yeah,
I appreciate that. I think it's also when there's a surge of need, even if all the stories about just like waiting lists, or, even if you're reaching out and doing it via telehealth. So yeah, clearly a lot more to be learned and figured out. So I'm not seeing other questions. Lord knows I've asked a lot.
It was fun. I like that it's kind of like a back and forth. It was fun.
So thank you. Incredible. We can't wait to hear more about this work. And we'll have you back, which is when hopefully you can come back to actual Madison and enjoy. I'm going to go ahead and upgrade your mother to being able to speak so she can say hi to you. But everyone else is free to leave.